It's Tuesday, July 27. This is the news on PBCJ. I'm Simone Absalom Gale. Due to rising COVID-19 infections, Prime Minister Andrew Holness has announced tighter curfew hours. The new measures start today, July 27, and will be in place for the next 2 weeks. Here are the details from the virtual press brief held on Monday. The Holness administration is seeking to reduce the amount of time allowed for movement.
Effective tomorrow, Tuesday, July 27, the curfew hours will be adjusted as follows. On Mondays to Saturdays, the curfew hours will be from 8 p.m. to 5 a.m. the following morning.
On Sundays and public holidays, the curfew hours will be from 3 p.m. to 5 a.m. the following day.
For Emancipation Day, which is Sunday, August the 1st, the curfew will commence at 3 p.m. and it will end at 5 a.m. the following Monday. Now, the following Monday will be observed as the holiday. So that means that the curfew on Monday, August 2, will start at 3 p.m. and end at 5 a.m. on Tuesday. Now, for Friday, August 6th, which is our Independence Day, the curfew will begin at 3 p.m. and will end at 5 a.m. on Saturday, the following day. On Sunday, August 8th, the curfew will start at 3 p.m. and end at 5 a.m. the following day, which would be Monday.
Tighter operating hours have been announced for beaches and rivers.
Mondays to Saturdays, beaches and rivers will be open from 6 a.m. to 4 p.m. On Sundays and public holidays, beaches and rivers will be open from 6 a.m. to 2 p.m. Now, reduced capacity. We had changed the measures under the last order of the Disaster Risk Management Act, where we transitioned to what we call capacity limits. So some establishments were subject to capacity limits of 70%. For example, places of worship, gyms, bars that operate under a club license, dining establishments, etc. Now, we have made some adjustments to that. Effective Tuesday, July 27th, the 70% capacity limit that applies to these establishments will be reduced to 50%.
We now get the latest COVID-19 clinical management summary from the health authorities.
In the summer for July 27, 2021, 52 new positives were reported, as well as one COVID-19 related death. The deceased is a 76-year-old male from Kingston and St. Andrew, whose death was previously under investigation. The overall death toll is now 1,179. The island now has an overall case count of 52,141 with 3,713 active cases. The parishes with the highest cases were Westmoreland 16, Kingston and St. Andrew 12, St. James 7 and Manchester 5. On the recovery side, 24 were reported, bringing that total to 46,892. At this time, there are 145 persons in hospital, with 42 patients moderately ill and 23 critical. Melvin Pennant, PBCJ News.
While the tourism sector is maintaining a near 100% compliance rate along the resilient corridors since the reopening of the nation's borders to international travel in June 2020, Minister of Tourism Edmund Bartlett has hailed the effectiveness of the sector in management of the COVID-19 pandemic. He credited the relentless efforts of the Tourism Product Development Company, working with the Ministries of Health and local government for enabling the high level of compliance by tourism entities. Minister Bartlett was speaking on the weekend at the launch of Key Advantage Training and Recruitment Solutions, Jamaica's latest addition to the education and skills training landscape at the Hilton Hotel in Rose Hall, St. James. The company has targeted the tourism and business process outsourcing sectors in particular, but also markets its services to the sales and retail industries. While underscoring the general success of the sector in managing the pandemic, Mr. Bartlett highlighted that complacency and breaches will not be tolerated. Being fully aware that other sectors are seeking to introduce systems to manage the coronavirus, he says, quote, "We stand ready to assist in enabling the complete management of the pandemic," adding that if all come together to drive that level of management, quote, "we will be able to carry through this process of enabling low infection rates," end quote. Prime Minister Andrew Holness says the recent opening of the IBX BPO facility in Portmore signals the confidence that investors have in the economy, even against the background of the pandemic. Ground was broken in October 2019 for the G-Tech Park Portmore Holdings Limited.
Every groundbreaking marks another milestone in the realization of Jamaica's economic development potential. In October 2019, I was here for the groundbreaking ceremony of this BPO campus. And since then, in spite of many setbacks on account of the ongoing pandemic, the first building from phase 1 of the project has been completed. So it gives me even greater pleasure, having broken ground a year or so ago, to now come to the grand opening and to declare open officially the first completed building. Investment in real assets such as real estate, you're not always going to make back your money right away. When you're putting down a building, it is a long-term investment. You're going to have a long-term horizon for risks to get that payback. So people would have to have great confidence, not just in the short term, but in the long-term direction of the country. And it means that the policy mix that we have as a government aligns with the long-term perspectives and expectations of the investors.
Mr. Holness says that the government will continue to expand the BPO sector through public-private partnerships so that Jamaicans can continue to partake in this diverse sector. The Consumer Affairs Commission says it has an 80.11% resolution rate for consumer complaints. Chief Executive Officer of Consumer Affairs Commission, Dulcie Allen, says millions of dollars has been reimbursed to consumers. She shared the details in a recent press brief.
CEO of Consumer Affairs Commission, Dulcie Allen, says 1,851 complaints were handled, and of that number, 1,454 were resolved.
In terms of compensation, $21.85 million, and this is in addition to the $24.5 million that we would have been able to secure on behalf of the net gratia payment on behalf of those persons who were affected by the bad gas scenario a few years ago.
She says the CAC has intensified their research activities through surveys and lab testing. They also provide a comparative grocery price list.
We ask that you go on our website and look at the information. We will not be able all the time to publish them in the newspapers, but certainly they are on our website and all our social media platforms. You can go and visit.
Ms. Allen is reminding consumers that they can report complaints against agents of microcredit.
So if you're having challenges, if you have borrowed, if you have gone into arrangements with persons in the microcredit area or sector, and you're having challenges, come to the Consumer Affairs Commission. We can try to assist you in whatever way possible.
The CAC is mandated to protect consumers by informing and educating them about their rights and responsibilities. Melvin Pennant, PBCJ News.
We get the latest market news with Gabriel Thompson in this quick business report.
In Monday's trading session, the JSE combined index declined by 1,113 points to close at over 420,000 units. Overall market activity resulted from trading in 94 stocks, of which 38 advanced, 43 declined, and 13 traded firm. The junior market index declined by 32 points to close at over 3,000 units. Stocks advanced for 1834 Investments Limited, AMG Packaging and Paper Company Limited, and Berger Paints Jamaica Limited. Stocks declined for 138 Student Living Jamaica, Barita Investments Limited, and Caribbean Cream Limited. Trading firm were Access Financial Services Limited, Carreras Limited, and Community and Workers of Jamaica CCU Deferred Share. Jamaica Broilers Group was the volume leader with over 2.3 million units, followed by Future Energy Source Company Limited ordinary shares with over 2.2 million units, and the Trans-Jamaican Highway Limited with over 1 million units. In foreign exchange trading for Monday, July 26, the US dollar sold for an average $154.84. The Canadian dollar ended trading at $125. The pound sterling traded for $214.77, and the euro sold for an average $185.34. In market data for oil, Brent crude futures added 0.16 points to settle at $74.66 a barrel. West Texas Intermediate crude saw no changes at $71.91 a barrel. And that's it for the Tuesday edition of the Business Report Inside the News on PBCJ. I'm Gabrielle Thompson. Pleasant viewing.
In regional news, amid an increase in COVID-19 cases and 2 new deaths, 2 healthcare workers on the front line of the COVID-19 fight in the Bahamas are speaking out against conditions at Princess Margaret Hospital. After seeing a new viral video of patients sitting in the rain on the porch of a critical care block, one official called it a sad day in healthcare.
It is sad. It is really, really a sad day for us.
As COVID-19 cases, hospitalizations, and deaths in the country soar, President of the Consultant Physician Staff Association, Sabrika Pender-Butler, says a video that went viral over the weekend offered a glimpse of the grim situation that patients and healthcare workers at Princess Margaret Hospital are facing.
If your healthcare institution is failing and is about to collapse, which I think is where we are right now, I think that we need to do a better job.
The video shows 8 patients covered by hospital blankets crowding a small porch of the critical care block as rain pours down. Some patients were in beds while others sat next to oxygen tanks. PHA said in a statement on Sunday that the area shown in the video is the triage site for the Accident Emergency Department, adding patients are screened for COVID-19 in keeping with the hospital's prevention measures.
It looks bad when you walk into the entry of a new block that just was built recently. It looks bad. You're serving patients in the front. I understand that you want to triage patients before they get to the back of A&E so you could avoid the patients that came in with emergency will not be exposed to COVID patients. Okay? But yes, that is the reason why you've had tents.
Officials have said that the hospital has reached its capacity for COVID-19 admissions. 92 COVID-19 cases are hospitalized, 10 of them are in ICU. Health officials are also reporting 133 new cases. According to Pender-Butler, the only solution now is to bring those doctors and nurses who are at home waiting for the public hospital authorities' call. She said that the current doctors and nurses are beyond their breaking point.
We've lost some of the SHOs, senior house officers, who are waiting to return to work. We've lost other physicians from the beginning of the year whose contracts were not renewed. We just don't understand, honestly, how persons can lose jobs at a critical time.
Williams says in addition to fighting fatigue, they are also losing colleagues to the virus.
We've lost 3 nurses COVID, okay, in 2020. In 2021, we've lost 1 from Grand Bahama, and 2 from Nassau. Not providing, people say, oh, they were not vaccinated. Really? Morale of the nurses it's up to the floor.
Reporting for R News, I'm Georgie O'Bain.
Health officials in Trinidad and Tobago say there has been a gradual increase in COVID-19 cases in the last 3 weeks, with a notable 8% increase in the past 2 weeks. Epidemiologist Dr. Avery Hines is cautioning the population to be even more stringent to avoid another possible explosion of cases. Sunil Lala reports.
With the opening up of the construction and food sectors, there's been more movement in the population, which comes with it an additional risk of more COVID-19 cases popping up. Epidemiologist Dr. Avery Hines says there began a decrease of cases from May to June, but that rate of decrease from June into July was beginning to slow and eventually reach a plateau. But in the last few weeks, and with the opening up of various parts of the economy, he notes that positive cases have again begun to rise.
We've seen slowly increasing numbers, or cumulative numbers, between over the last 3 weeks, 1% increase, 5% increase. The last week, between last week and the week before, there was an 8% increase.
Dr. Hines adds that the increase in cases is a cause for concern and is urging people to limit their movement.
We don't want to be preemptive and say that people are moving around too much too soon, because movement is necessary. However, we do want to encourage every individual to make wise choices about how they move, about where they move, about what they do when they move.
The Ministry's Manager of Geographic Information Systems, Roshan Siram Singh, says there continues to be a continuous downward trend of cases in communities, despite fluctuations in areas such as Caroni, Nariva Mearo and County Victoria. However, he notes that this data was taken from June 27th to July 10th.
So in this particular map, we see that there was only one community which we could identify which recorded over 40 cases, whereas before we were looking at several communities recording over 50 cases.
And with this country taking all precautions to reduce the Delta variant from entering, Dr. Hines says public transport must take their own precautions to avoid contamination in their vehicles.
We're seeing where public transport, they're proceeding along the road with the AC on and the windows closed. The only AC that we need right now is air circulation. The windows need to be open.
And even if that variant reaches this country, Dr. Hines says mask wearing and vaccinations will be critical to stopping or limiting the spread of that highly transmissible variant. Sonolala, TTT News.
In Guyana, the health minister has announced that starting Tuesday, his ministry will continue its nationwide inoculation of persons who have already received their first doses of the Sputnik vaccine. Gordon Mosley reports.
A total of 10,000 second-dose shots arrived in the country this morning and will cater for the remaining persons who received the first shot in April and those who got their first shot in May.
We know a lot of persons who took their first dose, and some of them are now becoming eligible for their second dose. And as you would recall, second dose is anytime between 4 weeks to 12 weeks. Initially, we were using the minimum period of that 4 weeks, but then we were advised that we can go to a maximum of 12 weeks. That is what most countries are now using. We have been following that protocol. So those persons, as of last week, as you would recall, we had started giving the second dose to those persons who got their first dose in April.
The vaccines will be distributed to the 10 administrative regions. There are thousands of persons awaiting their second shot of the vaccine to be fully vaccinated against COVID-19. The health minister today reminded that for those persons who have not received any vaccine as yet, there are still first and second doses of the AstraZeneca and Sinopharm vaccines available, as well as the first dose shots of Sputnik.
We have been giving 3 types of vaccines in Guyana. The AstraZeneca, which we have both doses of. And again, I want to urge people who got their first dose AstraZeneca to come and get their second dose, because we see a lot of people who took their first dose. Their time is due, but they haven't come back yet for their second dose. So we want to encourage those people to do that. Similarly, we have Sinopharm vaccines. We have both doses that are available, And again, those who took their first dose, we want them to come and get their second dose. And if there are persons who want first dose, they can get that as well.
More than 50% of Guyana's adult population has received the first dose of one of the coronavirus vaccines, while less than 30% of the population is fully vaccinated. The government is hoping to get at least 80% of the population fully vaccinated against the virus. The number of new cases of the virus and its death toll has been climbing steadily in recent weeks across Guyana.
In sports, Japan's capital, Tokyo, reported its highest number of new coronavirus infections on Tuesday, days after the Olympics began. The Prime Minister urged people to avoid non-essential outings, but said there was no need to consider suspension of the Games. Tokyo reported 2,848 new COVID-19 cases, exceeding its earlier record of 2,520 daily cases on January 7. That brings its total to more than 200,000 since the pandemic began last year. Tokyo is under its fourth coronavirus state of emergency, which is to continue through the Olympics until just before the Paralympics start in late August. Experts have warned that the more contagious Delta variant could cause a surge during the Olympics, which started Friday. And that's our package. Thanks for watching PBCJ. We are the People's Station.